Once again, we're here at Performance Medicine in Kingsport, joined by Dr. Tom Rogers, of course, as always, and we have a very special guest with us. Introduce him.
Well, everybody knows Ernest Dickson. He's a good friend and colleague now. He's a physical therapist, been practicing for around 30 years, and probably the nicest human you'll ever meet. He's well known around Kingsport for sure, but he works in the office and has his own private physical therapy clinic. And today I thought we'd talk about falls. I was talking to Don Markham, one of the folks at Bath Fitter,
right?
And we just happened to talk about why people fall and what they can do to kind of help make a bathroom that will be less kind of difficult to maneuver in, and they've helped a lot of people out. So I thought, let's talk about falls. And Ernest Dickson has worked with people for about 30 years, and I just wanted him to give some tips to folks on how to prevent falling and what causes a fall in the first place.
And we hear about it all the time, older folks taking a fall in the bathroom and other places in the house as well. Talk to us about some tips that we can pass along to our viewers to help cut down on those falls.
Falls are one of the leading causes of injuries, especially in older adults, and it's also one of the major causes of loss of independence. And I think if a patient has had a history of falls or they feel unsure of themselves, they're more they tend not to get out and move around as much. One of the most important things is maybe to go to the first thing is go see their doctor and let them check them really well. You know, it could be some medications they're taking, it could be an interaction of those medications, things like the pain medications, high blood pressure medication, those kind of things have an effect. Also check and see if there's any visual problems or any inner ear problems, because those all have a factor in falls. The other thing would be even, you know, if you could check with your physical therapist or, you know, and see if you have any strength deficits, any flexibility deficits, you know, check the reflexes, their coordination, balance, those kind of things. Those kind of things can be caught early, and if you treat it, then you can get some good outcomes on it.
And as we look at our aging population, you know, as we grow older, bones are more brittle, muscles don't react as well anymore, so those are things you have to, as a PT, you have to take that into consideration as well.
Sure, I think it helps to have a good evaluation, and if you have a coordination between the doctor and the PT, and you know that really helps the patient. And if you can, you know, if the patient can have a good home program to follow, that really helps them.
And we were talking about our good friends over at Bath Fitter. You know, they've got a full line of products where smaller steps, still get the same thing in walk-in tubs, things of that nature. There are avenues that older folks can take to take care of themselves.
That's exactly right. You'd be surprised how many people fall in the bathroom, whether it's the middle of the night or trying to get into a bathtub. I love the walk-in showers. I've had one put in at my house, and certainly liked it, but it's very important. I saw both my mother and my father fall and have serious consequences, and it was terrible.
And that's what we want to prevent. That's why we're here today talking about this. And they gave us some great tips here, folks. Dr. Tom Rogers, Ernest Dickson, thank you all so much for being with us today. It's Performance Medicine. Come by here. It's one-stop shopping for all your health needs. And if you want to check it out online, go to performancemedicine.net.
The preceding portion of Daytime was sponsored by